For more, Dr. David Rudd, founder of the National Center for Veteran Studies at the University of Utah, joins us now. Welcome there, Dr. Rudd.
Thank you.
So does this system of delivering health care to veterans need to change?
Well, I think the indications would suggest that it does. I think clearly the long wait times are a part of the difficulty. A part of what we need is better access and better availability of care. The VA certainly has been remarkably responsive to care, and I think all indications are that the VA is providing high quality of care. But given the number of veterans struggling with psychiatric issues, it's difficult to meet that demand, hire enough people quickly enough, provide access and availability of care in regions and areas of the country where we have high-risk soldiers.
Right, and multiple studies confirm what you just said, that the VA was found to have some of the best health care in the country. But I mean, it doesn't matter how good the health care is. You can have the best physicians working at these VA hospitals, but if they are understaffed and overwhelmed, ultimately it's going to be the quality of care that is going to suffer.
Oh, I think you're right on the money. I think that's the issue, that if they're overwhelmed, understaffed, not able to meet the needs quickly, that's the core issue. The other thing that we haven't mentioned is the issue of stigma. There are a number of veterans who simply do not believe that the VA is going to provide responsive, meaningful care, and we have to take that issue on. Opening up the availability of care to other providers outside of the VA system helps us in a number of ways with that issue.
Yeah, going along with this, it's no secret the VA, they're overworked, underfunded. We have long wait times. Mental health, as we had in that report, goes untreated for long amounts of time. I did a report about how drug abuse is running rampant in these institutions, even the one here in D.C., one of their main facilities. And this is a government-run system. So, Dr. Rudd, could this be an example of what a government-run system on a national scale in the U.S. could look like?
Well, I think a part of the problem is that the larger the system, the larger the bureaucracy, the less flexible, the less responsive the healthcare system is. That's why it's important to look at alternatives, to look at unique approaches, and really to look at, can we make care more readily available in some of these rural areas where our veterans are, so that they don't have to travel. We may have a much more flexible, nimble, responsive system. That's what I worry about. The larger the organization gets, the less flexible, the less responsive it can be.
And right off the bat, what comes to mind is Obamacare. And I guess I know some physicians myself that have gone through the VA system and have talked about how just how understaffed they are, how overworked they are, and compare what Obamacare could be to what the situation is in the VA, which is a very huge, massive institution as it is.
Well, it's the largest healthcare system in the world. I mean, the reality is it is the largest system in the world. The nice thing is they provide high quality, meaningful care. The question is whether or not they can be responsive in these critical incidents. So if you look at veterans, you look at what these needs are, the reality is we need people that can respond quickly when there's a crisis. Large systems have a hard time doing that more often than not.
Yeah, and actually, I want to bring up these statistics here that kind of illustrate just how massive this department is. 270,000 employees, 131 cemeteries, 152 hospitals. They disperse benefits to over 4 million veterans. So, Doctor, despite the enormity of this department, it still just is not enough to meet this overwhelming demand.
And I think that that's what these latest numbers speak to. I think that the reality is that the numbers suggest that we're not meeting the demands. The numbers suggest that maybe we need to be creative, we need to think outside of the box, we need to look at other alternatives, and the system needs to evolve. Rather than getting larger, we need to look at other options.
Right. I want to bring in these other statistics that show these new figures. Military suicides among active duty members of the military and veterans have skyrocketed and reached record levels. 349 suicides of active duty personnel in 2012. That's up 15% from the year before. 950 suicide attempts per month among veterans being cared for by the VA. And this one I think is pretty startling. U.S. military veteran commits suicide every 80 minutes. So clearly, the mental health issues of returning soldiers aren't being met. I know that you said that something needs to be done. We need to look outside of the box. So do you think that the answer is perhaps expanding their options outside of the VA so that they can seek help elsewhere?
Oh, absolutely. I would tell you that expanding outside of the traditional system is what we need to look at. We need to look at partnerships with local community providers, local agencies that provide that kind of flexibility in a more nimble, responsive system. If you look at an organization that's based in Nashville called Not Alone, one of the things that Not Alone does is they provide care, they help coordinate care for veterans outside of the veteran system. And they've been able to get corporate support and other donors that will help fund that care. So some individuals are already doing this. Some people are already out there trying to find solutions, trying to find a more flexible alternative.
So, and would one of the results of this be that veterans would be able to receive care faster,
That's the idea.
including mental health care?
And in cases where there are suicide risk and there's significant risk of harm in some ways, what's critical is how responsive, how fast we can provide care and not delay it. One of the things we know is when we delay care to individuals at high risk, that risk goes up as they wait for care. If you look at many of these negative outcomes, some of these tragic losses that we've experienced, those were among people waiting for care.
All right, we don't have too much more time, but of course, cost is always an issue. Even with Obamacare, a lot of lawmakers scratching their head as to how this is going to be funded. Would expanding this health care option to veterans be a cost-effective solution?
Well, I think it would. If you look at some of the recent findings, so if you look at some of the work that we've done here at the National Center for Veteran Studies, you look at some of the work that's been funded by the Department of Defense, there are a number of effective treatments for post-trauma stress disorder. There are a number of effective treatments for suicidality. Many of those treatments are time limited. Many of those treatments are restricted in terms of the amount of care that is required, and as a result, the cost of care. So if people will provide the care that has an empirical foundation that's been proven to be effective, actually it probably will be less expensive.
Really interesting. Really appreciate you coming on the show today. That was Dr. David Rudd, founder of the National Center for Veteran Studies at the University of Utah.
Absolutely. Happy to join you. Thank you.